Hello, in this video I'm going to be talking about estrogen-containing foods. What are they? Should you avoid them? How do you deal with contradictory information? Before I go on, I'd love to invite you to subscribe to this channel. We put new information out all the time about treatments for breast cancer and ways to cope with life during and after breast cancer, as well as videos on how to help people in your life who might be going through this. So we get lots and lots of questions about estrogen-containing foods. People want to know, is it safe to have such and such a product? And we thought this would be a great video to cover. So what I want to start with is, what's the relationship between estrogen and breast cancer, just to make sure we're all on the same page. Many breast cancers, the majority of breast cancers, are sensitive to estrogen. They're not necessarily caused by estrogen in your body, but once established, estrogen can help them grow. And blocking estrogen can help them stop growing, which is always a good thing. When we talk about estrogen in breast cancer, we're not talking about your levels of estrogen. We're not saying you have too high a level of estrogen. The amount of estrogen you have in your body is the just right amount for you. So this isn't about your own body's estrogen. When we talk about estrogen-containing foods, where would that estrogen come from? Well, in naturally occurring food, estrogens are present. There are animal estrogens from dairy products that, cows make their own estrogen. That's how they're able to lactate and make milk, and from that we make cottage cheese and yogurt, and my favorite, which is ice cream. So those are animal estrogens. And then there are also plant estrogens, which are referred to as phyto, or pertaining to plants, phytoestrogens. And these are natural products in plants and other naturally occurring, the fruits of plants, like nuts. So when we talk about, are they safe? There are a couple things that I want to make really clear. When we eat things in our diet that we know are good for us, like whole grains and legumes and soy products and flaxseed, things that you enjoy eating. Let's say you eat tofu, which is one of the most commonly eaten foods around the world. We're not talking in general about normal dietary soy. So a lot of you have asked really good questions. Is yogurt safe? Is tofu safe? Is flaxseed safe? And the answer is yes. Now that's the main message. The secondary message is that if we try to override and take extra high, ultra high doses of plant estrogen, so if you are having soy shakes with protein in them and you're trying to increase the amount of soy in your diet beyond what a normal person would eat in a day, we don't know that that's safe. And there are reasons to think it might not be. There are reasons to think that overriding a normal dietary amount might actually be unsafe. Now, we don't have a lot of data saying that. A lot of what I'm talking about is theoretical, and you may find yourself just as frustrated as we are when we go to look at the literature. Because when we study, let's say, economic vegetarians, so people who don't eat meat or don't eat certain foods, people who eat a lot of plant-based foods and a lot of soy, actually have a lower risk of breast cancer. And there's no evidence that their dietary soy increases their risk of breast cancer. But these folks who are economic vegetarians, because they can't afford meat, also have other things in their life environment, in their world, that are different from a more, let's say, Western diet. So it's really hard for us to know. So is there a concern that excessive levels of plant estrogens or animal estrogens could increase the risk of getting breast cancer or cancer recurrence? There theoretically is. What about interfering with treatment? Well, remember, a lot of treatments block the estrogen receptor, the selective estrogen receptor modulators like tamoxifen and raloxifene. You can check out our video on raloxifene if you'd like to. we know that those very same plant foods that we have could compete with tamoxifen and raloxifene. So there's a theoretical concern that a lot of dietary soy products, other phytoestrogens, legumes, nuts, other things that we flaxseed could interfere with treatment. Again, it would be very hard in your regular diet to exceed the effectiveness of breast cancer treatments. But if you are working really hard to have extraordinary levels of phytoestrogens, there is, we suppose, a theoretical concern. So the bottom line, you've been watching this video for a few minutes, the bottom line is don't spend your money on things that are designed to increase levels of plant estrogens. So you might want to check out our video on flaxseed as well. Other than that, normal dietary amounts are very likely to be safe. I hope this has been helpful. Drop a comment or a question below. We try to get back to you within a week or two. Please be kind. We're people too. Thanks for watching.